Jim, the thing that I found most interesting about this program was that you're not targeting the tumor, but rather immune tolerance in the tumor microenvironment. Can you explain the mechanism of action of the Delta Opioid Receptor and its inhibition and how that fits together with that and how it allows other drugs, perhaps checkpoint inhibitors or other approaches to work to actually eradicate the cancer?
Sure. So you mentioned the tumor microenvironment, which is kind of a fancy way of saying where the tumor lives. So think of the placenta with the fetus again, that model. So what happens when tumors form in your tissue, they secrete certain types of compounds called chemokines that attract anti-inflammatory cell types, MDSCs, regulatory T cells, macrophages, and these cells populate that tissue and they secrete and or destroy a lot of the mechanism by which the body has an immune response to a tumor. And so it creates an immunologic sanctuary around the tumor. We are particularly focused on a cell type called MDSCs. They are the big culprit, right? These cells secrete multiple soluble factors that essentially inhibit the ability of your immune system to become activated, or if it is activated, it inactivates it. And they call that T cell exhaustion in one setting. And so we've demonstrated that a single point of intervention, so if we block the delta opioid receptor, and we'll start with MDSCs. On MDSCs, we shut off multiple ways for these cells that they create this immunologic sanctuary. If you can remove that shield that's around the tumor, then drugs like checkpoint inhibitors or T cell therapies, CAR T, TILs, they should all be able to work better. They should be able to continue working, not develop this exhaustion where they stop working. And I think that the reason that that is so compelling is that a lot of companies are going after each of those soluble factors that these cells produce as individual targets, whereas we have a single control point, kind of a master switch. If we shut it off, the majority of them go off at a gene level and at what we call the protein level, the factors themselves. So, that's a very novel way to approach an area that a lot of pharmaceutical companies are trying to approach because it's kind of the holy grail, right? Checkpoint inhibitors stop working in that setting. T cell therapies stop working. And it isn't related to the tumor, it's related to the tissue in which the tumor survives and thrives. And MDSCs are just one of the cell types. There's two or three others. We mentioned macrophages and we mentioned T cells. They all play a very important role in creating this sanctuary, this immunosuppressive environment for the tumor to grow.